Are you a woman over the age of 50 who's been diagnosed with osteopenia or osteoporosis? Well, this is for you. My name's Dr. Ashley, and I'm a physical therapist here today to discuss some of the best exercise guidelines that I could find to help you improve or at least decrease your risk for further bone loss as you get older. So let's get started. When it comes to things like osteoporosis and exercise, if you're not familiar with this territory, I'm sure that you've gone to Dr. Google for help. Unfortunately, a lot of the information that I've found on the internet is simply misinformative. Unfortunately, what we've noted is that research shows that things like swimming, walking, and simply doing some type of aerobic step class, or even just going on a bike ride or cycling, they're gonna help improve your aerobic capacity, but it's not gonna give your muscles or your skeleton the challenge that it needs to actually help improve your bone density. I'm sure you've heard the term resistance training, and you've seen a bunch of things regarding resistance training as how to best improve your bone mineral density or your bone health over time. However, research in this area is inconclusive a lot of the time, but there have been some recent studies that give us a little bit of a better lens as how you can actually start rebuilding your bone density. But before I get into that any farther, I'd love for you to hit that subscribe button, and if you're enjoying our content, share this channel with your friends. In the United States, there are at least 10 million people who have been diagnosed with osteoporosis. Now, unfortunately for women, about 80% of those cases are in females. So what can we do to help combat osteoporosis over time? One of the other big things that we have to think about as one gets older is that osteoporosis also increases your risk for falls and fractures. If you don't continue to stay strong and if you don't continue to move, it is likely that 1 in 2 women over the age of 50 will fall and fracture their hip, especially if diagnosed with osteoporosis. So what I want to do as we go through this video is give you some tips and give you some ideas as how to best continue exercising or start exercising to decrease your risk for further bone loss and also possibly help you get some of that bone density back that you've lost. Now, I'm not gonna bore you with all of the research that I read in regards to this topic. However, there are 2 specific studies that I'm gonna kind of go over a little bit with you to actually give you a little bit of insight as to how doing some sort of resistance training may actually help you redevelop some of your bone strength and improve your bone health over time. The other thing that I should know when it comes to any sort of resistance training, making your muscles stronger and doing tasks that are outside of your norm, you're actually going to help improve your daily function. You're gonna move better, you're gonna feel better, you're gonna have more energy, and actually what you'll also do is decrease your risk for falls. And if you remember some of those statistics I gave you early on in this video, well, decreasing your risk for falls is actually extremely important when it comes to osteoporosis. Why? We want to decrease that fracture risk. All right, so I'm not going to bore you with all of the research that I read through in order to come to conclusions regarding exercise and post-menopause, especially when dealing with osteoporosis and osteopenia. However, there are 2 studies that I want to discuss a little bit to give you a little bit more insight as to what you should be doing to keep yourself a little bit healthier. So let's dive in. The first one, as you can see here, is named The Effect of Exercise Training on Bone Mineral Density in Post-Menopausal Women, a systematic review and meta-analysis of intervention studies. The next one I'm going to go into is a little bit different. It's an actual scientific study, not a meta-analysis of scientific studies. And the name of this one is High Intensity Resistance and Impact Training Improves Bone Mineral Density and Physical Function in Post-Menopausal Women with Osteopenia and Osteoporosis, the Lift More randomized controlled trial. So let's dive in and see what we've got. Let's start by going over the meta-analysis or systematic review. So basically what the authors of this paper did was they took 75 different studies, looked at the statistics, looked at their data, and compared it to all of the other data in this paper. They ran their own statistical analysis of all the different things that they read, and they compared it all. And that gives us a little bit of insight as to, hey, what should we be doing for things such as post-menopausal exercise and bone mineral density. So let's dive in a little bit. As I've already said, 75 studies were included in this, right? And they were consisting of different forms of exercise, whether it be weight-bearing exercise, non-weight-bearing, aerobics, aquatics, tai chi. We saw jumping programs, running programs, you name it, it was there. So there was a very widespread exercise routine base in this systematic review. There were inclusion and exclusion criteria here. Now, every woman in this study had to be postmenopausal at the initiation of the study. So when the study started, certain things such as medications were an exclusion criteria. A multi-sex, so men and women study, were excluded from here. The big thing that we needed in order to actually be included, right, was that there needed to be some sort of outcome measure. And what they looked for here was a DEXA or a DPA, right? So basically they were looking for bone density scans of the femoral neck, right, portion of our hip, a total hip, so a whole hip view, or our lumbar spine. Why? These are areas where we see osteoporosis pop up most often. Now, when we're looking at what they actually came up with in this study, well, unfortunately, not too much. There are a few things that we saw. Number one, exercise, no matter what type of exercise it is good for bone mineral density. And that's what you have to remember. You need to keep moving. Now, did it necessarily tell us which ones were superior? No. However, for certain parts of the body, what they actually found were things such as jumping, resistance training, and weight bearing, right? So actually doing things that load your bones and load your muscles more helped improve your bone mineral density. That's different from what people normally think in regards to, okay, I can go on a walk. Okay, I could do step training. Okay, I could do body weight training. Because what we're seeing is that in order to make a difference, right, we need to add some sort of impact through the ground, back through our body in order to make a change. There's an overload principle, which basically means that we need to be doing more than what we do on a daily basis in order to improve our bones. Now, the other thing that we noted, right, is that unfortunately, due to the vastness of the information out there, due to the amount of studies out there, and due to the lack of consistency across the studies, the individuals who did this systematic review were not able to make definitive recommendations specific for exercises to do for postmenopausal women with bone mineral density deficiencies. However, if we read a little bit, exercise is important no matter what. But let's go ahead and move in to the second research study, because this one is one of my favorites. So on to the randomized controlled trial by Watson et al., the high intensity resistance and impact training protocol. They basically took two groups of people, right? One that was separated into an intervention program and the other in a control group. What women needed to be in this program. Let's go over that really quick, right? Women over 58 years of age who had a low bone mineral density. These women also needed to be postmenopausal. If these women had any sort of recent injury, surgery, fracture, back pain, if they were less than 5 years post-menopause, if they had cancer, uncontrolled high blood pressure or cardiovascular disease, or anything that prevented them from participating in a heavy strength training program, I'm sorry, they were excluded. The reason being is the intervention in this research study actually included doing some heavier weightlifting, something that is not necessarily always prescribed for osteoporosis. Why? People are fearful that women are going to get injured. Fractures are going to happen. But what they actually found through this study is that if these women easily, or if they work their way up easy into a program where then they can actually do the movements and load appropriately, there were minimal adverse outcomes. Meaning these women, the biggest thing that they experienced was a muscle spasm in their low back, which does sometimes come along with the exercises they were doing. So what did these programs look like, right? So for the intervention program, it was a 8-month, 2 times a week, 30-minute supervised, high-intensity, progressive resistance training and impact program, right? So think about that. High-intensity, progressive resistance, and impact weight training program. Basically, the woman took the first month to get acquainted with the movements they were going to do. The coaches or the individuals working with them loaded them appropriately until they were able to get to about 80 to 85% of their 1 repetition max, which means the maximum amount of weight that you can lift in that specific activity for 1 repetition. What they then did for those 8 months was they participated in this program twice a week, performing 5 sets of 5 repetitions each at 80 to 85% of that 1 repetition max. Now, think about that. That's a lot. That's a good bit of weight. These women who do have low bone mineral density, osteopenia and osteoporosis, were doing this, and they were safe. Now, if we move into the control group, basically the alternative exercise group, these women did something similar in regards to the time frame. 8 months, 2 times a week, about 30 minutes each, but this was a home-based strength training program at 10 to 15 repetitions at about 60% of their 1 repetition max. So 60% of what you can lift for 60% of your 1 rep max, and 1 rep max, once again, is how much you can actually lift for 1 repetition in that specific lift. Their program included a 10-minute warm-up walk, lunges, calf raises, right? And then they went into doing things such as forward shoulder raises and shrugs. They performed different stretching exercises such as a neck stretch, some calf stretching, and things of that sort, followed by a 5-minute cool down walk. So these 2 groups couldn't really be more different, correct? So if we look at the generalized outcome here, what do you think the outcome was? We know that a lot of women will stick to the 10 to 15 sets, 8 to 10 reps at kind of a lower weight, thinking, hey, that's really going to improve my bone health. Don't get me wrong, it's going to help, but it's not going to be the best bang for your buck. So what we actually saw in this study is that the women who did participate in the intervention group, the 5x5 at a heavier percentage of your rep max, they built more bone back in those areas that were a little bit weaker to begin with, such as the hip, such as the low back, and they also reported significant improvements in their functional abilities on a daily basis. So overall, from what we can see in this paper, is that resistance training at a higher weight and maybe a lower rep, supervised, may be more beneficial for women in the long run. So after reviewing that information with you, what do you think? What do you think is most important for you if you are a post-menopausal woman with low bone density? Where I stand in this is that you need to be doing some sort of resistance training. You need to make sure you're loading your body more than you do on a daily basis to really promote increased bone health. Now, if you're worried, if you're scared, I do recommend finding somebody to help you implement a strength training program. The benefits surely do outweigh the risks, especially as we can see in that randomized controlled trial I just presented to you. So what I'm going to do next is I'm going to go through a series of a few exercises, and actually the ones that we did note in that study However, we're gonna show some progressions and make it a little bit easier for you to feel more confident starting. The big thing is that if you do not exercise normally, it is perfectly fine to start doing the movements to get accustomed to them, right? In the study, what they did was they gave the women a month or month and a half to really get used to doing the specific movements and made sure they did them properly. So let's go ahead, get started, show you some moves that you can use to hopefully help promote improved bone density over time. And as always, if you have questions after you see these videos, make sure you put them in the comments section below. All right, so we're gonna start with our first progression of exercises, and there's gonna be 4 different things that you try, each for 5 sets of 5 repetitions each. So let's go ahead. The first thing you're gonna do is just a body weight squat. So you're gonna go ahead, arms out in front of you, drop down, right? You're trying to get your knees or your butt below your knees, right? If that's not possible, go ahead and you can do something like a mini squat, right? The second thing that you're gonna work on is getting yourself associated with what we call a hip hinge. So you're bending at your hips, back stays nice and flat. Same thing here, kind of just repeat 5 times. Next, we're going into upper body a little bit. So what you're gonna focus on is kind of arms just out to the side and pushing up towards the sky as if you're pushing something over your head, right? And then the last thing that you're gonna start to work on is getting yourself accustomed to almost beginning to do a little jump. So we're gonna go, and if you have to, hold on to something, and you're just gonna do little quick calf raises, just like that. All right, so on to the second progression. So what you're gonna do, use some dumbbells. These should challenge you a little bit. It should feel hard, right? I'm not gonna go over how you find your 1 repetition max. I do recommend that if you're interested in completing the program that I did discuss in the video, that you find somebody to help you. But what you're gonna do, I'm gonna have you start with the dumbbells right at your shoulders, and this is how we're gonna go into the squat. You're just gonna drop into your squat here, right? So 5 sets of 5 repetitions. What you do after this, the dumbbells are gonna come right in front of you. You're gonna go into that hip hinge that I demonstrated where you're pushing your hips back and you go ahead, slide down, go ahead, pull back up. As you can see, I'm trying to keep my back flat through the entirety of this range of motion. Next up, after you go through that, is gonna be that overhead press with your dumbbell. So what you're gonna do, arms up to the sky. If you want, you can clap them together, right? Makes you feel a little bit better. 5 rounds of 5 there. I'm gonna go ahead, have you put the weights down. And for the next one, if you held on, go ahead and try to challenge yourself not holding on. But what you're gonna start to do is a small little pogo hop. So you're hopping, toes are coming off the ground a little bit, right? And just like this. Now, this is a little bit different than what is done in the protocol. However, this is something that's a little bit easier for you to implement at home. So let's move into the third progression of exercises, which will be the final one. All right, so for the next progression, you are upping your weights. You're gonna use something such as a small barbell or a barbell to actually make sure that you're getting to where you need to make that meaningful change. So in regards to the back squat, as you can see, if I turn sideways, my arms are spread out a little bit. It's kind of sitting right at where my neck is. You could roll it down if it feels a little more comfortable there, or you could keep it up a little bit higher. So what I'm gonna go ahead and do, similar to the other patterns that I did, is I'm just gonna go ahead and squat down, right? I'm going to where I feel confident and comfortable, and I'm gonna do 5 rounds of 5 repetitions. Now, the next thing I'm gonna move into, right, is a deadlift with the bar. So I have the bar in front of me just like I had the dumbbells, and I'm doing a little bit more of what we call like an RDL style, where I'm bending down, pulling back up, right? Just like this, 5 of 5 here. With the barbell, we'll also go into what's next. And obviously for each of these, weight's gonna change, but I'm not going ahead and doing that right now, just for the purposes of the video. We're gonna go ahead and bring the bar up in front of you. And what I'm gonna do here is just push up over my head, right? Just like this. And I'll turn sideways here so you can see, right? Going here, pushing straight up, coming back down, right? And then the last thing in regards to jumping that I'm going to have you do is we are simply just going to work on hopping a little bit taller. In the research study, they did hopping basically like pulleys, right? So you're hopping to a bar trying to pull yourself up. All I'm going to have you do is you're going to practice these jumps just a little bit higher, right? And you're going to try 5 sets of 5 repetitions at a time. So go ahead and give those a shot. As always, if you have any questions about what you saw in today's video, as I already said, make sure you put them in the comments section below. And as always, I'll be back with some more information soon.